Thank you for watching the video. Atopic dermatitis actually affects about 10% of the population. The intense itching can affect your daily activities, make you feel sluggish, sleepy during the day, and even impact your future plans. It can even impact your love life. It's a tough condition. I'll share things you can do without visiting the hospital. I'll introduce ways to deal with atopic dermatitis, how to moisturize, and how to apply ointment effectively. As a doctor, I regularly treat atopic dermatitis, and I often get various questions from patients, like not wanting to use steroid ointments, how much ointment to actually apply, or whether it's necessary to use it together with moisturizers. With the right knowledge and proper care, most cases of atopic dermatitis can be well controlled, and you can minimize the impact on your daily life. At the end of the video, I will also introduce some recommended moisturizers, so with this one video, you'll be able to improve the tough symptoms of atopic dermatitis. Please watch until the end. First, in section 1, I'll explain what atopic dermatitis is. In section 2, I'll introduce 3 ways to deal with atopic dermatitis before going to the hospital. Then, in section 3, I'll talk about the actual treatments for atopic dermatitis. I'll explain how to apply ointment and how much to use. Finally, in section 4, I'll talk about important points regarding moisturizers and introduce some recommended moisturizers you can buy over the counter. As a doctor, I share information that can help you become healthier starting tomorrow, so I hope you'll continue to check out my content. Now, let's begin with section 1. The cause of atopic dermatitis was actually something unexpected, so let's talk about it. In short, the cause of atopic dermatitis is a decrease in the skin's barrier function. Our skin has a layer called the stratum corneum, which is made up of multiple layers of dead cells. Because of this barrier, things like dust, mites, and foods that can cause allergies are usually kept from entering our skin. However, for people with atopic dermatitis, the skin barrier is damaged, so moisture from inside the body evaporates more easily, making the skin prone to dryness. Allergens like mites and dust can also get in, causing inflammation. This is what happens with atopic dermatitis. Have you heard of the term atopic cycle? The beginning of the atopic cycle is this worsening phase. This worsening refers to inflammation caused by some substance entering the skin affected by atopic dermatitis. When inflammation occurs, our body tries to fight off the invading substance by releasing various chemicals, but this also causes itching. Naturally, when you feel itchy, you scratch, and by scratching, the inflammation becomes even worse. This causes more itching, scratching, and inflammation, making the atopic cycle repeat. This results in the condition getting progressively worse. In the past, dermatologists would often tell patients with atopic dermatitis to just endure the itching and that things would get better if they didn't scratch. But I think it's really difficult not to scratch when you're itchy, so nowadays the main approach is to suppress the inflammation itself, which is considered the key to breaking the atopic cycle. And another characteristic of atopic dermatitis is that it is often closely related to allergic diseases. Actually, the skin usually acts as a barrier, but when you have atopic dermatitis, various substances can penetrate through the skin and enter the body, which activates our immune system. Because of this, the immune system is constantly being stimulated through the skin, so when you actually inhale pollen, your immune response becomes stronger, which can lead to hay fever, or if your bronchial allergies worsen, bronchial asthma. Recently, it has even been said that atopic dermatitis is related to food allergies, so properly treating atopic dermatitis brings benefits not only to the skin but to the whole body. Now let's review the first lesson. Atopic dermatitis affects about 10% of the population and can interfere with work, cause daytime drowsiness, influence job choices, and have various impacts on daily life. On the other hand, many people lack proper knowledge, but if you take the right measures against atopic dermatitis, there are many cases where it can improve. And I explained that the cause of atopic dermatitis is a decrease in the skin's barrier function. With a decrease in the skin's barrier function, the atopic cycle continues, causing the condition to get worse and worse. And since atopic dermatitis is also related to allergies, I talked about how important it is to manage it properly. Now, in the second part, I will introduce 3 ways to deal with atopic dermatitis before going to the hospital. It's true that your skin is itchy and it's tough, but you just don't have time to go to the hospital. You want to do something about this discomfort as soon as possible. I have good news for people like you. Here, I will introduce measures you can take before going to the hospital. The first of the 3 ways to deal with atopic dermatitis before going to the hospital is dealing with dust mites. If you're wondering whether atopic dermatitis and dust mites are really that related, actually about 80 to 90% of people with atopic dermatitis have allergies. Among those, it's said that dust mites are very commonly involved. By cleaning and reducing the number of dust mites indoors, it's quite common to see that skin symptoms are alleviated by doing this. There are special vacuum cleaners for cleaning dust mites from bedding, and another recommendation is to use anti-mite sheets, which are sheets that make it hard for dust mites to stick. Just by switching to these, many people see significant improvement in their symptoms. Here is the second of 3 atopic dermatitis treatments to try before visiting the hospital. It's cooling the affected area. For those who think, cooling doesn't help my itch at all, or for those who have never tried it, please give it a try just once, even if you think it won't work. Actually, the sensation of cold can dull the itchiness caused by atopic dermatitis. It raises the threshold, making it harder to feel the itch. Try placing a cold can of juice or something similar on the itchy area. You'll experience the itch fading away temporarily. If you can resist the urge to scratch and first calm the itch, then apply ointment. You can avoid damaging your skin and reduce inflammation, making this a very effective method. On the other hand, you need to be careful with things like taking a bath or a hot shower. When you do this, your skin warms up and blood flow improves, which can increase the substances that cause itching and make the itch even worse. So, when your atopic dermatitis is flaring up, please be careful with hot baths and hot showers. The third hospital recommended measure for atopic dermatitis is dealing with dryness. Dryness is one of the causes that can weaken the skin's barrier function. As I mentioned earlier, people with atopic dermatitis already have a weakened skin barrier, and when dryness is added, the barrier function drops even further. This allows various substances to enter and causes moisture to evaporate, which makes inflammation worse and worse. That's why it's especially important for people with atopic dermatitis to moisturize properly. I actually have dry skin myself, and I often get dry skin dermatitis and eczema. I keep moisturizers everywhere, in my lab coat, my work backpack, the bathroom, and by my bedside. And there's one more thing about moisturizing that many people often misunderstand. The word moisturize literally means to maintain moisture, right? So moisturizers are meant to maintain something that already has moisture. So, even if you apply moisturizer to a dry area, it doesn't make sense if there's no moisture to begin with. That's why when you apply moisturizer, the right timing is right after taking a bath. Apply moisturizer while your skin is still moist after bathing. By doing so, your skin's ability to retain moisture will improve, and it will be less likely to become dry. Just make sure you always moisturize after hydrating your skin. By the way, what kind of moisturizers are you all using? Some of you might be using ointment types that are clear and a bit sticky. Others might be using cream types which are white, easy to spread and smooth, or lotion types which are liquid and light. Some people might be using ones that are really easy to spread and don't feel like they stay on the skin much. Actually, each of these types has different characteristics. Simply put, keep in mind that the stickier something is, the more moisturizing it tends to be. So, in order of stickiness, ointments, creams, and then lotions are the most moisturizing. In my case, since I can sleep even if it's a bit sticky before going to bed at night, I choose an ointment type. But before going to work, I get bothered if it's sticky. Recommended measures for atopic dermatitis include mite control and a way to cool the skin during sudden itching. And finally, I talked about the importance of taking measures against dryness. Now, let's move on to the third part. In this section, I'll explain what kind of treatments are actually used for atopic dermatitis. Also, there's talk that steroids are dangerous, but is that really true? I'll also briefly explain the amount of ointment that makes it easier to heal atopic dermatitis and how to apply it. There are 4 main types of treatments for atopic dermatitis. The first is treatment to suppress inflammation. This is especially important when the skin gets worse, becomes red, and starts to itch. In those situations, the main medicine used to suppress inflammation is actually a drug called steroids. In addition to that, sometimes tacrolimus is also used, and in cases that are difficult to treat or don't heal easily, sometimes injectable medicines are used as well. That's right, and once the skin condition stabilizes with these treatments, the next step is to start maintenance therapy, which is treatment aimed at keeping things in remission and maintaining the improvement. One well-known method is called proactive therapy, and I'll explain that in more detail later. And third, there are also supportive treatments. With atopic dermatitis, it's difficult not to scratch when it gets itchy. Sometimes medications like anti-itch drugs are prescribed to help relieve the symptoms, even just a little. And fourth, one of the biggest enemies of atopic dermatitis is moisturizing is important to combat dryness. And since bacterial infections can occur as a complication of atopic dermatitis, keeping the skin clean with proper skincare is also a very important part of treatment. Now, I'd like to show you the appropriate amount of ointment to use. Please take a look at this image. There is ointment on the first joint of the fingertip. This is called a 1 fingertip unit. Well, it's written as FTU, so this amount is 1 FTU. Please remember that this amount of ointment is enough to cover the area of both palms. Isn't it more than you expected? You can cover your neck with both palms, so if you want to apply it to your neck, you need to use an amount of ointment equal to 1 fingertip unit. 1 FTU is equivalent to 0.5 grams. For example, let's say your entire limbs are itchy. The surface area of all your limbs is about the size of 10 palms, so you would use about 5 grams of ointment. 5 grams is about the size of a small, that's 1 whole tube of ointment. So just applying it to your limbs once a day will use up 1 5-gram tube. That's how much you need to apply. How about you? When you receive ointment, are you using it at that pace? Actually, even in outpatient clinics, when I teach people how to apply ointment, many say they didn't know this at all. They say things like, I wasn't using that much, or when I used plenty, it healed quickly, and I wish I had known this sooner. I hear these comments a lot. What really surprised me in the outpatient clinic was when I was prescribing ointment to a patient with atopic dermatitis. I asked, you're probably running low on your medication, so how many tubes should I prescribe? But the patient said, actually doctor, I still have this much left, and showed me. It was when I saw that there was still a lot of ointment left from what I had prescribed before. At that moment I realized that just prescribing ointment isn't enough. I need to properly instruct patients on how to apply it as well. If possible, I should even have them actually apply it right there in the outpatient exam room. I realized that I really need to go that far. If you know anyone around you who is struggling, please let them know. Also, the period for applying the ointment is important as well. Basically, please set the application period according to your doctor's instructions. Generally, it is often said that you should apply it every day for at least 2 weeks when the condition is worsening. For the first 5 days or so, apply it generously twice a day, and if it starts to get a little better, after that, apply it once a day. In total, you should be instructed to apply it every day for 14 days or 2 weeks. And when the condition of your skin improves, what is often done is called proactive therapy. Let me explain what proactive therapy is. Please take a look at this diagram. This diagram from the Atopic Dermatitis Treatment Guidelines shows skin symptom severity on the vertical axis. As time passes and you apply steroids or other treatments and your skin condition improves, if you stop applying the medication completely, it can easily get worse again. So when your skin is in good condition, for example, you might start by applying ointment once every 2 days, and if your skin still stays in good condition, you could reduce it to twice a week, like only on weekends, Saturday and Sunday. Apply the steroid, and if that's still okay, you can reduce it to applying the steroid once a week. In this way, to prevent flare-ups, you should regularly apply ointments like steroids that suppress inflammation. This is called proactive therapy. This condition, atopy, actually, even if the redness goes away and the skin looks clear, there can still be inflammation left in the skin. There is a period like this, so it's said to be important to regularly apply anti-inflammatory medication to prevent the condition from from worsening during this time. I often prescribe steroids in outpatient clinics, and I also use steroids myself when my skin gets irritated, but I've had mothers of patients say this to me. I've heard that steroids are dangerous, so I absolutely don't want to use them on my child. I can certainly understand why you would feel concerned about that. In the past, there was actually a television program in Japan that reported on steroids as if they were dangerous drugs, and because of the influence of that program, misunderstandings about steroids have spread. It's true that there are side effects from applying steroid ointments. To give you some examples, if you use a large amount for a long period of time, the area where you applied it may become hairier, it can become more susceptible to bacterial infections, you might develop acne, be more prone to skin infections, and it's said that the risk of eye diseases like glaucoma may also slightly increase. However, these side effects are extremely unlikely to occur unless you apply a much larger amount than what your doctor instructs you to use. And it's also said that most side effects will improve if you stop using the medication. On the other hand, there are also some misunderstandings like this. I don't like using steroids because they make my skin darker. I'm also worried that steroids will make my skin thinner. I don't want to use them. I don't want to use steroids because they make my whole body feel unwell. All of these are misunderstandings. While it's true that strong inflammation from atopic dermatitis can make the skin darker, steroids themselves do not cause the skin to darken, and there are no reports of the skin becoming thinner when using normal standard amounts. Steroids are actually very good medicine when used correctly, and I also use them regularly myself, so I think it's important not to be too afraid, but to use them properly and wisely. Now let's review the third period. The treatment of atopic dermatitis can be broadly divided into 4 categories, including steroids and tacrolimus, which suppress inflammation, and there's proactive therapy to maintain remission. I also mentioned symptomatic treatments to relieve itching and moisturizing skincare, and also the correct way to apply ointment and the duration for which it should be applied. And I also provided accurate information about steroids. Now finally, in the 4th period, I'd like to introduce the recommended moisturizers you've all been waiting for. There are 2 main moisturizers that I usually prescribe at the hospital. These are white petrolatum and heparinoid preparations. I think many of you have been prescribed these at the hospital, haven't you? This white petrolatum it's the most common ointment, very gentle with minimal irritation, and it has almost no side effects, so it's widely used. On the other hand, what's been used more frequently lately is this heparinoid substance. It's said that its ability to retain moisture is 2.5 times higher than Vaseline, but on the other hand, its drawback is that it's considerably more expensive than Vaseline. Another benefit is that this heparin promotes blood flow, which helps reduce inflammation and speeds up the healing of wounds. Those kinds of effects are expected, so after learning about these features, please choose the one that suits you best. Please try choosing a moisturizer that suits you. Now I'll introduce 2 effective moisturizers that you can buy without going to the hospital. The first one is this. This is an ointment called Cetaphil, which is a cream type. What's good about this is that it comes in a large size, so you can use it with peace of mind. Earlier, I talked about the amount of steroid ointment to apply, but the same goes for moisturizers. Using just a small amount sparingly won't help. It's important to use plenty and apply it generously. That's why Cetaphil is great, because it contains as much as 566 grams. And since it's a cream type with very little stickiness, it's easy to apply. So if you're not sure which moisturizer to use, I think it wouldn't hurt to give this one a try. And another moisturizer I recommend is this one called Aquaphor. I think this is a good option for people with sensitive skin. It's written in small letters on the package, but actually, this is a moisturizer for babies. Babies tend to lose moisture easily and generally have less water in their bodies, so moisturizing is very important. That's why this cream has a high ability to retain moisture. If you feel like your skin still gets dry with regular moisturizers, this is what I recommend for you. So what did you think? This time I shared a variety of information to help improve atopic dermatitis. In the first part, I explained what atopic dermatitis is, the decline of the skin's barrier function, and the atopic cycle. In the second part, I discussed at-home measures for atopic dermatitis, like reducing dust mites and cooling the skin that don't require hospital visits. And I also recommended taking measures against dryness. And in the third part, I talked about what kind of treatments are actually used for atopic dermatitis and how ointments are often not applied correctly. I explained the amount of ointment that makes atopic dermatitis easier to heal. And finally, in the fourth part, I talked about the differences between the two types of moisturizers that are often prescribed, as well as those that can be bought over the counter. I also shared some recommended moisturizers. I'll keep making videos to help you get healthier starting tomorrow. As a doctor, I will continue to share information in a responsible, easy to understand and enjoyable way, so I hope we can learn together if you'd like. Well then, see you in the next video. The way to live without aging from your 70s, as taught to me by my patients in general medicine. It became a bestseller and ranked #1 in the gift ranking in the Amazon 4 limited categories. I compiled into one book the important ways of living and health methods that I learned from my patients while working as a doctor. It's a book that will make you think, I want to live a healthy life like this too. It's on sale now and getting great reviews, so please check it out.